All right. Good morning, everyone. Glad to have you with us today on July the 11th, 2025 for our monthly webinar with the Southeastern Coastal Center for Agricultural Health and Safety. My name is Ricky Telg. I'm one of the co-PIs for this center. I work with the Outreach Corps here in our Southeastern Coastal Center, and it's my pleasure to welcome you to today's webinar that will focus on charting the course, sleep studies in America's fisheries. Dr. Julie Sorensen will be leading that in just a moment. I do want to mention to everyone on the call today that you will have the opportunity to ask questions or post comments through the Q&A button on the bottom of your Zoom screen. We don't have a chat set up for this webinar. It's through the Q&A. So at any time during Dr. Sorensen's presentation, if you have a comment or a question, please feel free to put it in the Q&A. And at the end of her presentation, I will help to facilitate those comments and questions overall. Also, at the end of today's presentation, we'll have a link that I'll put in the Q&A as well that will take you to an evaluation of today's presentation, as well as to find out more about ideas that you would have for potential webinar topics in the future. So today, again, the topic is charting the course, sleep studies in America's fisheries. Today's presenter is Dr. Julie Sorensen. She is the director of the Northeast Center for Occupational Health and Safety, Agriculture, Forestry, and Fishing in Cooperstown, New York. And this is really an overview of a proof of concept study examining the impacts of sleep deprivation in U.S. commercial fisheries. And so with that, Dr. Sorensen, I'm going to stop sharing my screen and you can start your screen sharing there as well. And thank you for being with us today.
All right. Thank you for the invitation. I'm really very happy to join you all today to share a little information on a study that we actually completed a few years ago. And as you mentioned, I'll mostly be focusing on the methodology because number one, I think it's helpful in kind of encouraging other researchers to get into this area of research. And number two, I think this study was really just the beginning, and I think there's much more to be done. And I will talk about that a little bit more later in the presentation. But I think the other thing I should know is we are still in the process of publishing much of the data from this study. We have a lot of data. And so we have welcomed anybody who's interested in this topic to reach out. And if they would like to partner with us, we can work with them on encouraging them to explore other research hypotheses and publish additional data on this. Also, people are welcome to reach out to us if they have questions about methods. So I think I'll get started. Just a shout out to our funders. This project was funded through a NIOSH U.S. Coast Guard cooperative agreement. Yeah, I think we'll get started. I like to start this presentation by just taking a moment to give some well-deserved praise to our research team for their incredible dedication and resourcefulness throughout this project. As you can see here from this slide, there are many who assisted from the Northeast Center team, and we were also very lucky to have our regional partners from the Alaska Maritime Safety and Education Association, or AMSE, Oregon State, and George Mason University, and they all offered support and guidance throughout the research process. Now, as you'll see in the subsequent slides, this study was challenging from start to finish. And although our crew was not attempting to trek to the Southern Pole like Shackleton's crew, their long months of tireless work deserve both honor and recognition. So a shout out to all of them. So as many of you who work in fisheries are already aware, commercial fishing is the second most dangerous industry in the US. Logging is currently the first. BLS fatality data from 2023 indicate fishermen are 25 times more likely to die on the job than the average US worker. Transportation incidents accounted for 71% of these deaths, while entanglements, crushing injuries, and overdose deaths are also responsible for many fishing fatalities. So given that, you may be asking, with all of these traumatic injuries and contributing factors to investigate, why did you choose to focus on sleep studies in fisheries? And although it's true there are many hazards in the commercial fishing industry, we chose to focus on sleep studies or sleep and outcomes in the fisheries for two reasons. Number one, there's very little research that had been conducted on this topic when we launched the study back in 2019. So you can see, as shown in the figure to the right, out of the 6,554 articles on occupational sleep research, only 4 related to fisheries workers. The second reason that we decided to focus on sleep studies is that, you know, in our conversations with the U.S. Coast Guard and other fisheries researchers, we were made aware that fishermen, number one, get very little sleep on the job. And I think that people in the industry, stakeholders, U.S. Coast Guard folks included, they have long suspected that lack of sleep significantly impacts safety and potentially fishermen's health, although up to the time we took on this study, there was little research looking at the impact to health as well. So given the lack of sleep studies in the fishing industry, we were interested in exploring 3 things. So number one, we wanted to see what is the potential for conducting fisheries sleep research. For example, we wanted to know whether fishermen would participate doing surveys or health assessments, or whether they would use wearable devices that would document sleep and sleep cycles. And is it even possible to collect this data effectively on a boat? We also wanted to look at sleep times and sleep cycles on the boat, diet, caffeine intake, how all of these things impact fishermen's health. And lastly, as I mentioned in the first slide, we really wanted to develop a foundation for future fisheries sleep research so that we could develop hypotheses and then continue researching this topic in the years ahead. So to get started and to broaden our understanding of sleep patterns and risk factors among fisheries workers, we decided to recruit fishermen in 4 fisheries and 3 coastal regions of the U.S. These fisheries were selected by our fisheries partners who indicated these fisheries were some of the most sleep deprived sleep deprived fishing crews in the country, with the exception of lobster fishermen. We chose inshore lobster fishermen because they don't typically sleep on the boat. They typically they go out and come back the same day, although that's not always true. There are offshore lobster fishermen, but generally, they're day fishers. So we included them because we wanted to have a comparison group of fishermen that was likely to have less restrictive sleep schedules. In addition to including multiple fisheries and regions, our study benefited considerably from the input of a transdisciplinary team of researchers. So NIOSH defines transdisciplinary research as a process whereby researchers and practitioners work jointly using a shared conceptual framework, drawing together disciplinary specific theories, concepts, and approaches to address common problems. So in order to really increase our understanding of sleep patterns and impacts on fisheries workers, we were very fortunate to have the input of epidemiologists, statisticians, practitioners, sleep experts, promoters, community engagement specialists, engineers, safety trainers, fishing associations, and most importantly, the fishermen themselves. So this slide, I know there's a lot of information on it, but this slide is just hoping to give folks an overview of the results of our at-sea trials of wearable sleep technology. So this component of our research was led by Dr. Lee McHugh-Weil. She's an engineer and researcher from George Mason University. And in this trial, we had hoped to identify a device that fishermen could wear comfortably and which would accurately track sleep times and sleep stages. So to identify our sleep tracking device options, we reviewed the literature, compared device capabilities. We also reviewed the options with fishermen to get their feedback. And in selecting devices to trial at sea, we hope to avoid items that might be considered higher risk for entanglement. So for example, many fishermen don't wear rings because they're afraid of the rings getting caught on the gear. And they see that as a safety risk. We also expanded the ways they might wear a device. So we used Actigraphy and Actigraph watches, and we looked at whether they could be worn on the ankle, or the waste instead of the wrist to reduce risk of entanglement. As you'll see in the table, we ended up choosing Fitbits, Actigraph watches, Dream devices, an Oura ring, and Hexoskin smart shirts. So as you can see in this table, these devices store data in different ways. Most are water resistant and track sleep stages, although the Dream device is not water resistant, and Actigraph watches don't track sleep stages. So those were the exceptions. But the leading issues that we encountered with these devices were comfort. So in particular, the Dream device was considered very uncomfortable, kind of hard to sleep with it on, which is a bit of a problem because it changes the data that you're gathering. Data storage, the Fitbit would only retain data for 7 days before being overwritten, but our fishermen could be at sea for longer periods. And then the movement of the boat raised concerns about the validity of actigraphy devices. So these devices work through tracking movement during sleep. And because the vessel is also moving, it could lead to inaccuracies in the data. So those were the things that we basically encountered with those options. So we trialed these various devices at sea with fishermen. We gathered feedback from the fishermen who attended health assessments, and I'll talk about them a little bit later in the presentation. But what we found was that when you look at tracking sleep across those various devices, the time it says that fishermen are sleeping is fairly consistent. The problem is the time in each sleep stage was not consistent across devices. So I think that's a problem that has to be resolved. As I mentioned, for the actigraphy um, watches, we had to develop an algorithm that would cancel out the movement of the boat. And, depending on the boat or sea state, there's this question of how accurate the algorithm is. So the actigraphy watches still present some challenges. And then we also found that multi-sensor inputs provide more accurate sleep and sleep stage data. And in the health assessments, we surveyed fishermen and we asked, would you have any interest in wearing any of these devices? Most of them said no. Some of them said maybe. Um, a few said yes, and a few said they're already using them. So I think when it comes to tracking sleep using by collecting objective data, there are still a few bugs that need to be worked out there. But just to summarize, I think that some of the big challenges include user considerations for the potential for wearables to get caught in equipment and cause injury. The devices need to endure extreme temperatures and wet, windy environments, and users were also concerned about the use of data captured on their devices. For example, sometimes these devices track location, and fishermen are not thrilled about that. So that's something to consider. The comfort of the device was also a concern on getting subjects to wear them consistently. And so, given this, if a fisherman takes off the device, then the ability to track data accurately is compromised. We also ran into some issues with battery life for some of these devices. For example, the Dream device, it's expensive, number one, but it also connectivity and battery life was a bit of a problem, although this is probably the most accurate way to track sleep data. Um, and then the Hexoskin device requires some assistance setting up the device. And also with Hexoskins, the device has to be sized to the individual. So these, again, are things that have to be worked out in future sleep studies. So in addition to looking at how we could capture sleep data objectively, we looked at or worked on surveys that would allow us to collect data from the fishermen themselves. And at the beginning of the study, we'd envisioned using Fisheries permit lists to randomly sample subjects for the surveys and health assessments. So the plan was to have each fisherman complete a survey and a health assessment. And as you can imagine, we ran into a number of issues with this approach. So number one, permit lists varied by state. So in some states, we didn't have phone numbers to contact the fishermen. And so then we had to go and search down phone numbers. Another issue we ran into is in the scallop fisheries, which they were included in the study. There are no lists of license holders, so we couldn't select a random sample of potential participants for this fishery sector. I think the other challenge is, easy enough to survey people over the phone, but if we were going to do the health assessments, and we were going to randomly sample subjects, it would be difficult to drive over large swaths of land with a medical research team to do health assessments all over Alaska, for example, where sometimes there's not even a road from port to port. You have to take a plane. So what we did instead was focus on cluster sampling, where we selected certain ports, and then we randomly selected fishermen within those ports. And then to recruit participants, we sent information on the study by mail. We followed up with phone calls. We sent texts. And lastly, we emailed fishermen to ask them if they wanted to be included in the study. We also sent media kits to fishing associations and news outlets to let fishermen know more about the study, who we are, and how to recognize this if we were in their port. And we also wrote an article in National Fisherman magazine, and that was particularly helpful in getting the word out. So to do the surveys, we largely conducted those over the phone with fishermen. For some, we emailed them or mailed them. It was really up to them how they wanted to complete the survey. The survey questions had been informed by qualitative interviews we had done prior to the surveys, and those interviews were conducted with fishermen. And we also took a few questions from prior health surveys conducted with fishermen. In all, the survey contained 68 questions, so a lot of questions, unfortunately. But the list of topics that we covered is shown in this list here. So although we were able to collect survey data from 262 fishermen, it was not at all easy. The calls to fishermen in Alaska meant our crew on the East Coast had to stay up very late to catch fishermen when they finished work. And then it also took many calls to successfully recruit one fisherman. So about 12 calls for every fisherman recruited. That was actually 19 calls for every lobsterman recruited. And this was largely due to the transition to cell phones, which makes it easier to block calls, and the increase in robocalls or scam calls. Yeah, so I think the other thing that we noted is that there were a few other researchers doing surveys with fishing communities, and fishermen mentioned they had been struggling with a little survey fatigue. So the health assessments that we also, in addition to collecting data via surveys, we did health assessments with fishermen. This was really the biggest challenge in this study because we had, in total, we did 31 clinics for 162 fishermen in Alaska, Oregon, and Massachusetts. Now, in order to do this, we had to have a team composed of a physician or a nurse practitioner, a technician, and an assistant. And logistics were incredibly complex because fishermen's availability was always changing. In the middle of this, we had airline strikes. So we would be ready to fly out and do a health assessment, and then the airline would be on strike. COVID rates, we had members of our team who tested positive, and then we'd have to shut things down, or other challenges, logistical challenges. So, but I will say that overall, despite the challenges, the clinics were very well received by fishermen. One of the fishermen who took part in the health assessment said, "I just had my annual exam at my typical health center, and that lasted 5 minutes, and then came to you and had a really thorough exam that took 45 minutes. Thank you." So we were really hoping to ensure that we had, like, everyone who took a survey, that they also did a health assessment. But again, it was difficult because trying to align schedules with our crew and the fishermen was a bit challenging. So we did some dockside recruiting in order to increase our sample size. We did expansive outreach in the dockside recruiting by getting the word out by radio, social media. Local fisheries partners got the word out, and we also went dockside and asked people hey, are you interested in health assessment? We'll give you one for free, and then we'll kind of talk you through the results. So the data that was collected in the health assessments included we captured a complete medical history for each fisherman. We documented BMI, vision, we conducted peak flows, random glucose, cholesterol, 10-year cardiovascular risk, PTSD, we had a PTSD screener. We looked at sleepiness using the Epworth Sleepiness Scale, and then our clinic providers provided each fisherman with a thorough physical exam. So just to summarize on this part of the study, we completed 162 health assessments. Unfortunately, these people were not all randomly selected, so there's a question about the representativeness of our sample. But as you can see, these are all the people who were involved in the study in just kind of Alaska and Oregon alone. So, given that, I think that's, really the best we can hope for. Especially when you're transporting equipment, trying to locate facilities, and schedule subjects who seem to be constantly on the move. So, yeah. So, in conclusion, I think, really what we've learned from the concept testing component of this study is that it is possible to conduct research on the topic of sleep in fishing communities, but there are going to be a number of challenges in this type of research. It's difficult to identify truly random samples of subjects to participate. Um, and future research will really need to incorporate time to engage with the population and increase buy-in in the initial stages of the research. And then it's also important to recognize that fisheries sleep studies require considerable financial investment because there's a lot of equipment that's required, and then staffing and travel to kind of recruit fishermen and collect the data. I think it's also important to address fishermen's concerns about their data privacy and to find opportunities to make the research relevant. So for example, if we find, and not surprisingly we did, that fishermen spend very little time sleeping while they're on the boat, what then, right? They have no choice, right? So how do we take this data and make it something that's useful for the community? So we can get into the data now that I've talked a lot about the methods. If you look at current medical recommendations for the number of hours that people need of sleep per night, which is about 7 to 8 hours, we can see how much sleep fishermen are not getting. So the data depicted in this table was all based on self-reported sleep schedules. And you can see we broke it out into several categories. So you can see each fishery. And the top row shows the average total of hours of sleep per day. The second row shows the least total hours of sleep a fisherman might get per day. The third row shows the average number of consecutive hours of sleep per day. And row 5 shows the least number of consecutive hours of sleep per day. Or I'm sorry, it shows how many days a fisherman might go with getting the least hours of sleep per day. So looking at the data, nobody on a fishing boat is getting a lot of sleep. Well, we didn't capture this from lobster fishermen because, like I said, they go out, come back the same day. But we see that scholar fishermen are generally getting the least amount of sleep. And those differences were significant across fisheries, in particular for least total hours of sleep and least consecutive hours of sleep. And I think it's interesting because, like I said, this is not surprising. The question is, what do we do about this? And I think this is captured really nicely by a fisherman that I would like to quote. He said, so there's 52 weeks in a year. The average person works 5 days a week. That's 260 days. Fishermen have 7 months to fit into those 260 days. So the reality is we're not going to be getting much sleep. So given the importance of sleep for an individual's overall health, and certainly for their neurological health, what does this mean for fishermen? I think it's really probably difficult to say since the concept of brain health is very complex. So this diagram was taken from an article that explored brain health in the research literature, and it tries to capture the complex factors that can affect brain health. As these authors indicate, brain health is not set in stone. The brain has the potential to improve even in the presence of underlying pathology. It's also multidimensional and involves several domains of brain function. Brain health can also improve or decline based on the presence and modification of risk factors as well as protective factors. And lastly, measuring brain health is very difficult as you can use both objective or subjective measures. So I think that's just kind of good background for trying to understand our data and what we found. The other thing is I wanted to play a short video on the kind of what sleep does in the brain, because I think when we think about the fishermen and their lack of sleep, you can see how over time this might be considerably detrimental to their neurological health.
There's not audio coming out of that, Julie.
There is not. I hear it, unfortunately,
Okay.
but you guys do not. Okay.
It's maybe coming through your headphones and not.
Should I skip the slide, or I could just give a quick summary?
I would do the summary.
Okay, sounds good. So basically what this video is talking about is how sleep is really the brain's way of cleaning out waste products from the brain. And, it happens in various sleep stages, and the video talks about, kind of the mechanics of removing waste from the brain during sleep. But I think it's interesting because, the question is if fishermen are getting very little sleep and that waste is accumulating, does that put them at risk for neurological conditions? And I think that's something that does have to be studied in future. No, it doesn't want me to forward. Okay. So since fishermen are not getting 8 hours of sleep, then the question is, what can they do to maximize the other pillars of brain health or the other protective factors that would help them reduce their neurological risks? So in addition to sleep, the other pillars of brain health include physical exercise, cardio health, strength training, diet. The optimal would be low carb, low sugar, and food rich in antioxidants. Medical health, a normal BMI is ideal. Diagnosis and treatment of other issues such as diabetes or high cholesterol is very important. Mental health and fitness, kind of general brain health fitness. So, are they getting diagnosed and treated for depression or other mental health issues such as PTSD? Social interaction and support. Do they have, things that allow them to stay intellectually stimulated, support from family members when they're having difficult days? And I think what I'll show in the next few slides is, in addition to sleep, they're not they're not kind of checking the other boxes of brain health. So, yeah, so, this is just a real quick overview, and I would encourage you to visit some of our publications that we have already published. But I think one of the things that we looked at was their use of caffeine. So any beverage that offers over 200 milligrams of caffeine is not actually providing additional performance enhancements, but can have negative health effects. So the recommendations for best performance call for small doses of caffeine taken at regular intervals. According to the fishermen in our study, they typically consume around 3 cups of coffee per day and around 1 cup of tea. But when we asked about energy drinks such as Red Bull, Monster, Bang, or Rockstar, almost half of crab and scallop fishermen indicated using them. Now, during this study, we talked to a Department of Defense sleep researcher, Allison Brager, and she said, according to her studies with the DoD, they have significant concerns about the neurotoxicity of these beverages. So that might be one way we can offer fishermen some advice on how to improve brain health. In addition, looking at mental health, we see some stark differences from trends in the general population. So during the health assessments, we had a PTSD screener. It's got 5 questions. It's used in most clinical settings. And the questions relate to traumatizing events or events and how they react to them. So answering yes to 3 or more questions typically results in a positive diagnosis screen for PTSD. And as you can see here, 12% of the men participating in this study screened positive for PTSD. And this is compared to just under 5% for the general population of men in the US. So another source of concern. And although we were able to collect a lot of data on health, sleep schedules, and other risk factors, we were not able to gather data on the intersection of sleep and safety. And what I mean by this is that, one of the things that we wanted to look at was, after fishermen had been at sea for a week and had kind of lost a lot of sleep, what did their executive functioning look like? What were their reaction times? What was their accuracy of recall? All of these things can kind of lead to skipping various safety tasks that they might have on the boat, or limit their ability to think quickly in ways that kind of prevent them from being harmed or falling off the boat and drowning possibly. Um, so I would really love to have somebody explore that in a future study, or perhaps someday we can revisit this. I think the other thing that we were concerned about in trying to make sure this research was helpful to fishermen is, how do we get the information out to them? And when we interviewed fishermen, many of them expressed concerns about their health, asking about dementia, cardiac health, as well as mental health. And we realized we could share late-breaking research that offered answers to their questions by developing a podcast. And so we did that. We called it Fishing Forward. And in this podcast, fishermen and topical experts shared their thoughts and solutions on everything from sleep to dementia to crew retention to the pain to addiction pipeline. The podcast is available on SoundCloud, and we have a link provided on our NEC website. I also want to give a shout out to Hannah Harrison and Phil Loring, who helped us collaborate on this project. So highly encourage you to check that out, and hopefully there are a lot of fishermen out there tuning in. In addition, we've been looking at other ways to share the results of the study out to fishermen to kind of alert them to the major takeaways. And so another way we've done that is to provide social media posts, because fishermen actually use social media quite a bit. We have a summary report that's featured on our website, and we also try to do presentations on this topic at fisheries events whenever possible. So I think that is it, which gives us quite a bit of time for questions. I can stop sharing.
All right, great. Thank you very much,
Yeah.
Dr. Sorensen. So there is time for any comments or questions folks may have. Please feel free to put that in the Q&A. This will be a good time to do so. Well, Julie, as people are maybe putting together questions here, what came out to you as maybe the most uh, uh, result of the study, finding of the study that you had maybe had some thoughts about, but this was truly confirmation that this is, I mean, what you just presented is wonderful, but maybe that one nugget of information is like, okay, of all things that we found, this is the one that really sticks out to you as being truly either foundational or what that finding might be.
Well, I think the key thing that we learned in this study is that, like I said, we knew that fishermen were probably not getting a lot of sleep. Now we know how little sleep they're getting. But what we learned is that if sleep is one of those 6 pillars of neurological health, brain health,
Mhm.
and there's nothing they can do about that, right? They have a very short window to do much of the work that they're doing. Um, then the hope is that they would be hitting those other pillars of health, brain health, pretty hard, and they're not. So consuming energy drinks, smoking cigarettes to stay awake, not having a good diet on the boat. Many of them talked about, their boat diets aren't good because there's not a lot of room to pack food or store food or cook food. Um, Social support, that's hard to do when you're at sea, and crew relationships can be very difficult when you're sleep deprived and in a crowded space with a bunch of
Mm.
people. You know, it can be tricky. So, um, I think what we're hoping to do moving forward, and we have done this at fisheries events, is to have tables that talk about how do you caffeinate strategically? How do you eat a healthy diet on a vessel? How do you maximize the sleep that you get? Can you sleep bank? Can you, do other things to kind of maximize your sleep while you're off the boat? Um, Things like if you want to improve your recall, executive functioning, reaction time, drink a cup of coffee, take a 15, 20-minute nap, and when you wake up, you'll be ready to go back to work again and more safely. So just giving some practical advice
Mm.
about how to work in a sleep deprived environment, and how to maximize their brain health by doing other things that they, with a little assistance and support and ideas could probably do. Um, there was one other thing I was going to mention. I mean, and then additionally, there's a lot more that we have to learn about sleep and fisheries. I think one of the things, I had a great conversation with a colleague from the Royal National Lifeboat Institute, and we were talking about safety and sleep deprivation. And we were saying that, I think we just take it for granted that fishermen are not going to be thinking clearly when they've had very little sleep on the boat. But we just assume, well, they'll figure out how to make it work. But could you, I guess the question we ended with ourselves was, is there a way to redesign a boat that can plan for inattention? Lack of, uh, you know, lack of executive functioning or recall or lack of the ability to pay attention. So, can you color code some things that need to be shut when weather is is bad on the vessel, or um, you know, other kinds of reminders of what fishermen need to do so they don't have to think about it themselves. They can get a little help in remembering those things when they're, I mean, think about how hard it is to do something when you've had 4 hours of sleep.
Yeah, very good. Thank you very much.
You're welcome.
Uh, we do have a question here. Taylor asked, you might have mentioned this, but did you collect self-report sleep times and compare to objective device measures?
We did not do that. And the reason we did not do that is our plan originally was to get a bunch of sleep devices out on boats. And we realized we could not do that because number one, the devices were way too expensive. And then number two, we had to train the fishermen on how to charge and, you know, put on the devices and upload the data. So there was a lot of one-on-one training on how to use the device. So what we did was that component of the study was really more of a pilot project, and our sample size was very small. And so we probably had, I think we ended up having 7 or 8 fishermen who piloted these devices, or maybe it was more like 10. Um, but and we did ask them to track their sleep to self-report it, and we did compare what they self-reported to the devices, and it was pretty similar. We it just we didn't really do much with that data because the sample size was so small. So
Yeah.
that'll be a big challenge in upcoming sleep research, is to figure out how to do that financially and logistically.
Okay. I have a question here too. Were the fishermen generally aware of their extreme lack of sleep? Do they think it was affecting them to this extent, or was that more of a surprise?
I think they were aware, and I think they were concerned. What is the long-term impact of this on my health? Because, I think you could look at this and say, well, fishermen have never gotten a lot of sleep. But really, the circumstances in fishing have changed a bit. And also we have exposures we haven't traditionally had like 100 years ago, energy drinks and
Hmm.
other things. So I think that they were kind of concerned, like, what are the implications for my long-term neurological health?
All right. Are there any other comments or questions folks may have? Or okay. If not, I just want to say, Dr. Sorensen, thank you so much for your time today, for presenting this information. It has definitely implications and impact not only for fisheries, but I think in other areas where the sleep is a desired commodity, but comes sometimes at the expense of other things that people are having to do as well. So thank you for this research. I know that others, if people have any questions, can they reach out to you about?
Absolutely. And if somebody wants to do a sleep research study in fisheries, please talk to me. We have a lot of notes we could share.
Great. Well, thank you. I do want to say to our webinar participants today that I put in the chat for you this link. This is for a post-webinar survey. You'll also be getting this by email because you placed your information in when you registered for this webinar. We do want to hear from you about not only this topic, but as I said at the onset of today's presentation, to give us some feedback and some ideas about potentially future webinar topics as well. So on behalf of the Southeastern Coastal Center for Agricultural Health and Safety, again, my name is Ricky Telg. I just want to say thank you very much for joining us today. We do have potentially two webinar topics that we're finalizing for August. So be on the lookout for more webinar topics from our center in the very near future. And with that, I just wish you a very good day. Thank you very much.